Can genetic mutations be passed down through family? Imagine discovering that some traits or health conditions run in your family, and you're curious about how that happens. Well, the answer lies in the way genes work and how they pass from parents to children. Genes are tiny segments of DNA that carry instructions for building your body. Each person gets two copies of every gene, one from your mother and one from your father. Sometimes, these genes change, creating what we call mutations. Mutations can happen in different ways. Some are inherited, meaning they come from your parents' genes. Others happen randomly during your lifetime and are not passed on. When a mutation is inherited, it can influence traits like eye color or height, or even health conditions like certain inherited diseases. There are specific patterns in how these mutations are passed down. The most common are autosomal dominant, autosomal recessive, and X-linked. Autosomal dominant means just one copy of a mutated gene from either parent can cause a condition. If a parent has this mutation, each child has a 50% chance of inheriting it. Conditions like Huntington's disease follow this pattern. Autosomal recessive conditions requiring both parents to pass on a mutated gene. Usually, carriers show no symptoms but can pass the mutation to their children. If both parents are carriers, each child has a 25% chance of inheriting the condition. Cystic fibrosis and sickle cell anemia are examples of this. Many people don't know they are carriers until they have a child with the condition or get tested. X-linked conditions involve genes on the X chromosome. Since males have only one X chromosome, they are more often affected by these mutations. Females have two X chromosomes, so they might carry the mutation without showing symptoms. Duchenne muscular dystrophy is an example of an X-linked condition. Not all mutations are inherited. Some happen during a person's life and are called somatic mutations. These are not passed to children. Only mutations in egg or sperm cells, called germline mutations, can be inherited. Many health issues like heart disease, diabetes, and some cancers are influenced by multiple genes and environmental factors. These are called multifactorial conditions. They tend to run in families but are harder to predict because they involve many factors. If your family has a history of genetic conditions, genetic testing can help. It can identify mutations linked to specific health issues. Testing can show if someone is a carrier or has a mutation that raises their risk of disease. This helps with planning medical care and family decisions. So, yes, genetic mutations can be passed down through families. Understanding how these inheritance patterns work helps families learn about their health and make smarter choices. If you're curious about your family's genetic history, talking to a healthcare provider or genetic counselor is a good step to get personalized advice and next steps.